An active lifestyle demands healthy legs, but vein disorders can actually slow you down. Dr. Robert Cutchin, founder and director of the Albuquerque Vein and Laser Institute, is here with us this morning to tell us how we can learn to love our legs again. And boy, do we want to love our legs. Tell our viewers, first of all, welcome. Thank you for being here today.
Thank you. It's great to be here.
Well, I think it's a topic that a lot of people think about, but maybe feel uncomfortable to talk about. And so I think it's wonderful to bring awareness and give some understanding to a topic that people want some solutions to.
Yes.
So let's first talk a little bit about your practice at the Albuquerque Vein and Laser Institute.
Well, we opened our clinic about 2 years ago, and we are dedicated solely to the diagnosis and treatment of vein disease, and it's our only focus, and all of our treatments are minimally invasive. Everything we do is done right in the office, and our patients are immediately back to activity, so that's great.
Really? So not a lot of downtime if they need any kind of procedure?
Very little downtime. In fact, we encourage our patients to be back on their feet and walking immediately.
That's amazing, and I think that dispels a lot of myths and fears that people have right off the bat.
Absolutely.
I want to get into the signs and the symptoms because I think a lot of people are curious, is this a varicose vein? Is this just a, what is this? So I think we need to talk a little bit about what varicose veins actually are and how we know that that's what we have.
Great. Well, the first thing in understanding varicose veins is understanding the job of our veins.
Okay.
And the job of our veins is to carry the blood back to our heart.
Sure.
So when we're talking about our legs, that blood should flow from our legs back up towards our heart. And as shown in this graphic, the blood should only flow up. Inside of our veins, we have these little valves, and they're like little one-way doors. They open, that allows the blood to flow up.
Okay.
But gravity's always pulling on that blood.
Yes.
And when it does, the valves are going to snap closed. And when the valves closed, as shown in this graphic, that prevents the blood from flowing back towards our toes.
Wow.
And the problem with a varicose vein is that it's become overly dilated and those valves have given out. And the result is that gravity wins and the blood flows right back down that vein towards your feet. Well, that puts a lot of back pressure and congestion inside the vein, can make those veins bulge out. And that's what causes the discomfort, is all that back pressure in the veins.
Do you find that if people are more overweight, that's when they see it more because of that pressure?
Interestingly, weight has never been shown to really be one of the big causes of varicose veins. The #1 cause is genetics. It just tends to run in families.
Okay, so that's the #1 sign to look for if your parents have that issue. Okay, so let me ask you this. How do varicose veins differ from spider veins?
And
how
really,
do we tell the difference?
Really, it's an issue of size. Varicose veins are those larger veins. They're going to tend to be anywhere from 1/8 of an inch to 1/2 inch in size.
Okay.
And spider veins are those little tiny red or purple veins that you see just on the surface of your skin.
Okay. See, I always wonder how you can tell the difference. So symptoms to look for. We know genetics are obviously, a risk factor, but what are the symptoms we want to look for specifically?
And the biggest thing people complain of is just their legs feeling kind of heavy, achy, tired. And that can range from other symptoms of burning and throbbing or itching.
Okay.
But for most people, it's just kind of a heavy, achy, tired feeling in their legs. Worse typically when they're standing.
Okay.
And oftentimes they'll get a little bit of relief if they lay down and kick their legs up.
Well, that's interesting what you did with the graphic, because it was interesting to see how gravity, how it has such an effect on it. And now as we look at this picture, what are we seeing here?
Right, and I've just included here a few pictures of patients that we've treated, and these are kind of the textbook patients that have some bulging veins showing on their legs.
Okay.
And most of these patients, as I said, are going to come in and see me with symptoms of heaviness and aching in their legs. And over the course of years, as that blood flows backwards down those veins, it's going to eventually cause these little branch veins to bulge out. So that's what we're seeing in these images here.
Oh, so now, is this just a superficial problem, or is this actually going to be a problem internally as well?
It's a great problem. That's a great question, rather. In our legs, we have deep down veins, but we also have veins that are just under the skin, these superficial veins. And varicose veins are superficial veins, which aren't the important veins in our legs.
Okay.
And so it typically isn't going to cause deep internal problems.
Good.
What's interesting to note is that over the course of years, varicose veins can damage the skin. Much like smoking will damage your lungs, it can cause discoloration and damage to your skin, which can culminate in a sore on your leg.
Wow. Okay. Well, see, but it's good to know, because I think people are concerned about their own health, despite, obviously self-consciousness that they might have just from seeing that on their legs. And I think that what you offer is so wonderful, because I do believe, especially in a state like New Mexico, where we have so much sun throughout the year and such hot days, people want to wear shorts, but they're self-conscious of their legs. So let me ask you how common this is. I mean, are we seeing this in a lot of people?
It's really common. In New Mexico, it's fairly common. It's anywhere between 15 and probably 25% of the adult population.
Really?
And some people may have it and not know it,
Okay.
but it's pretty common.
Are you finding that a certain age group in particular gets more prevalent than others?
It's always going to get worse as we age.
Okay.
So while we see patients in their 20s, we also see patients, of course, all the way into their 80s.
But you do see people in their 20s as well.
Yeah, it's not real common, but we do. Most of our patients are probably in their 50s.
Okay. Well, is it possible to have varicose veins but not actually see them bulging out?
It is. Not everybody has those giant bulging veins like we showed in the pictures.
Okay.
And your suspicion should rise if you have those symptoms of heaviness and aching and tired in your legs.
Okay, and of course the genetics, as you mentioned, as
Yeah.
well. Okay, so those are the ways that we know if we have the varicose veins. Now, you said that the treatment is fairly non-invasive and that it actually allows you to get what you need done but be able to walk out of the office later that day. So I'm curious of the role of the ultrasound when you evaluate these and how you treat this.
Right, so these veins, in some, like we said, in some people they do bulge out, but the answer always lies underneath the skin and helping us know exactly where this problem is starting, and that's why we need ultrasound.
Okay.
And the ultrasound is performed with the patient standing, that way we can test their veins against gravity and see if they're working, if they're carrying the blood normally like they're supposed to, or if they're letting the blood flow backwards. Without ultrasound, we're pretty blind, so we rely on it in our diagnosis, but also in our treatments, where most of our treatments are actually done live under ultrasound imaging.
Interesting. And then the treatments generally take about how long?
It depends. Some of our treatments can take anywhere between 15 and 20 minutes, and some of our longer procedures maybe will take up to an hour and 15 minutes.
That really isn't that bad. And I would imagine you need to obviously do the screening ahead of time to know what you need. So what is involved with the free screening that you actually do, which I think is wonderful that you offer that.
And so some of our patients do come in for a free screening to see us, and those are patients who may not be sure of what's going on with their legs or what kind of treatment they may be a candidate for. That's about a 10-minute long appointment where we just go in and briefly review their medical history and some of the symptoms that they're feeling in their legs. I take a look at their legs and try to decide if we're looking more at a cosmetic problem or more of a medical problem that we're going to go ahead and bill to the insurance. And those are going to be our patients who have symptoms of discomfort and also have findings on their ultrasound that show that their veins aren't working right. So at that screening, if we feel like they are more of a medical candidate, then we'll invite them to come back for a full, about a 1 hour long consultation where we actually do the ultrasound.
Okay, great. And I think it's important from this point forward that we let everybody know how they can find you. So let's get that contact information up. Let everybody know how they can find you.
Well, by phone you can call us in Albuquerque at 848-VEIN, which is 848-8346, or you can check us out on the web at albuquerquevein.com.
Excellent. And here's some really good news. If you are concerned about your own varicose veins, Dr. Cutchin will be back next Monday to tell us about those treatment options. Thank you so much.
Thank you so much.
Really informative and really helpful information. I think you've dispelled a lot of myths as well. Thank you.
Thank you.
And are you ready to get your groove on? The James Douglas Show is going to get you moving this Monday morning.